Welcome to Danatech Talks, a special series from CDCES's The Huddle, Conversation with the Diabetes Care Team. I'm Dana Moreau of Danatech, and in this series, we're going to dive into the latest in diabetes technology, bringing you expert insights, clinical strategies, and the innovations that are shaping patient care. So whether you're brand new to diabetes tech or looking for the next level of expertise, Danatech Talks is your source for real-world knowledge. Today's episode is made possible thanks to an educational grant from Abbott. Thanks, Abbott. Today, we're going to go back to the basics, and we're being joined by Katrina Flaskerud, MS, RDN, LD, CDCES. Katrina is going to give us a high-level but foundational overview of diabetes technology and what kinds of devices are out there today. Katrina, welcome to the Huddle.
Thank you for having me today.
So we're going to start where we almost always start, and we'd love for you to give us a little bit of background on who you are, what you do, and really anything else you think would be interesting or valuable to the audience.
I am a registered dietitian and diabetes care and education specialist. I work with diabetes technology on a daily basis, and because of that, technology is really important to me. I think it's a great tool for helping empower patients in their diabetes self-management. And that's why I'm so excited to discuss this topic today based on my own personal perspective and experiences.
We haven't talked to you before, and we're always very excited to have a new guest with a fresh perspective. So again, today we're talking about the basics, so we're going to take a few steps back. When we say the basics of diabetes technology, where do you think that a healthcare professional who is new to this space should begin? What is their starting point?
Ooh, such a good question. There are so many varieties of types of diabetes technology available on the market at this point. I think a good place to start when we think about the basics of diabetes technology is just to learn about the different categories of the different devices that are available to persons with diabetes and just in general, how each of those different types of devices work.
Yeah, clearly there's a lot of options out there, and sometimes they can be overwhelming. So when you start to look at the technology that's available, do you think that there's maybe like a gateway technology that's an easier entry point for people who are looking to become more knowledgeable on the topic as a whole?
I think continuous glucose monitors are a great place to start, both for the provider, but also the patient with diabetes as well. It can provide more insight into how a patient's medication regimen and their lifestyle choices are impacting their diabetes. And I think it's a great place when you're looking into learning more about technology. I feel like this is also a great next step because many patients are monitoring their glucose levels with finger pokes. So this can be a piece of technology that can apply to many different types of patients.
That makes sense. One of the things we talked about, and we hear this a lot from the clinicians we've talked to in the past, is the concept and the idea of time, and really lack of time. You only have so much time to spend with a patient. And sometimes there's a concern that, if you or I am dealing with this technology, I'm going to have to spend more time than I have allotted. What do you think the simplest way to introduce technology is in a short period of time and without overwhelming anyone and everyone involved?
That is a really, really good question. It is challenging. I think one of the best places to start is comparing it to technology that a patient is already familiar with. So that way you kind of have that base knowledge and that starting point. And then you can talk about with this new piece of technology, what are the potential advantages and disadvantages of incorporating that piece of technology? So for example, when we think of the continuous glucose monitor, we can talk about how is that different from doing the finger pokes and the blood glucose monitoring, and then what are the advantages of switching over to a continuous glucose monitor?
Yeah, I know that's so important because there's still a lot of people who think this is going to be overly cumbersome. But honestly, once you get people started, it does become easier. And the data can seem overwhelming at first, but not once you truly understand the basics. And from what we hear, the data can be incredibly eye-opening, both for the clinician and the patient alike. Does this resonate with what you found?
Definitely. And I feel like when you are limited on the amount of time when you're introducing that technology to a patient, it could be maybe that first visit you really start and focus on how to implement that piece of technology and then have a return visit to discuss the data and go more in depth on that piece of it.
Yeah, it's such a great foundation. So to give us more context, can you walk us through at a high level what the main diabetes technology device categories are? So what's out there today that clinicians, regardless of where they're at, really should be familiar with, at least at the most basic level?
So I would say that there are four main categories that I would consider. The first one would be continuous glucose monitors. And this type of technology is really helping with monitoring glucose levels more continuously than blood glucose monitoring. With a CGM, it's measuring the glucose levels in the interstitial fluid. And there's two main types of continuous glucose monitors. We have the intermittently scanned continuous glucose monitors and the real-time glucose monitors. Now, with the intermittently scanned, that one does require the patient to manually scan to save the data, even though the data is being continuously collected through the CGM. Now, this type of sensor is kind of being transitioned away from, I think, for the most part. I feel like more and more sensors available on the market are more of the real-time one, where no scanning or interaction with the sensor is really needed while the patient is wearing the sensor. So another category of technology that's available for diabetes are the connected pens. Some of them are caps that you put on top of an already existing pen. Other ones are pens that have the technology already into it, and you put just a cartridge of insulin inside. And this type of technology is great for patients who are looking for assistance with calculating their insulin doses, or maybe wanting that ability to record their insulin doses as well into an app. And then we have insulin pumps. So there's two different types of insulin pumps. I feel like this category is pretty big. So insulin pumps in general, how they work are, it is giving rapid acting insulin at a set rate. So that kind of basal insulin. And then the patient kind of interacts with the pump to give the bolus for meal times. Now then there's the AID, or automated insulin delivery, insulin pumps. And how that differs is that a CGM is communicating with the insulin pump, and then there's an algorithm that then is used and will adjust the basal rates based off of the CGM data.
So with all these categories in mind, and I can't believe in about 6 months we'll have 2 more categories at least, how do you go about matching the right technology with the right patient? And at a higher level, I guess, who tends to benefit the most from each option?
I think the best place to start is having a conversation with the patient. The patient provides great insight into themselves. They know themselves best, and they know what challenges they're running into and what they would find beneficial, or what types of aspects they're looking for. And so with that conversation with the patient, you can kind of help figure out, okay, what pieces of technology would fit best to meet their needs.
That's a great answer because, again, it is evolving. I think years ago, there was a belief that only certain people could benefit from technology. Some people might be overwhelmed that maybe it was for type 1 only and not type 2 or gestational. This is really no longer true. So you're right. Probably often matching the right person to the right tech has everything to do with the person themselves. What they're interested in, what they're willing to take on, what they're trying to learn, and importantly, what they're trying to achieve. So along those lines, what clinical indicators or patient factors should healthcare professionals weigh in on before recommending a device?
There's a variety of different factors that should be taken into consideration. Of course, patient preference is always something, but we do need to take into consideration the type of diabetes the patient has. While technology is becoming more inclusive and is able to be used for both people with type 1 diabetes or type 2, there still are some that are indicated for only certain types of diabetes. Another thing we need to take into consideration is insurance coverage and cost, just because that's a factor when it comes to managing diabetes. Is certain things are preferred by certain insurance companies. And then also a patient's medication regimen should be considered as well too. Certain technology really can help reduce the burden of diabetes management when you have certain medications. For example, if someone's not on a multiple daily injection of insulin, one of those connected pens wouldn't be appropriate in this type of setting.
Yeah, that makes sense. And we've been talking about this primarily from the clinical side, but there's also a patient side here. In your experience, how did these tools, how have they changed the way patients engage with their own care?
I think that these tools really help reduce some of the barriers that patients experience and also can help reduce with diabetes burnout as well too, because it can simplify their regimens. A lot of this technology helps with doing calculations, or you're not having to think about diabetes as much. It takes less time to look and monitor your glucose level. And so because of that, I think using like a continuous glucose monitor, for example, can really help engage a patient in their diabetes management because they're able to see right then and there how their choices, taking their medications or their lifestyle choices, they get a real-time response and can see how their management is going.
Again, most of my career, my favorite phrase is you can't measure it, you can't manage it. So that step alone, I'm sure, is very helpful and quite surprising, I would imagine, to a number of people who are put on or choose to put on CGMs for the first time.
Definitely. I have a lot of patients that are like, I had no idea that was going on at that time of day, and they're really surprised, but it's valuable.
Yeah. And the data is sort of fun and, again, surprising depending on who you are. So there's a lot of benefits to the patients using these technologies. Are there benefits to the healthcare professionals as well?
Definitely. I feel like with this technology, a lot of it is doing recording of the data, whether it's recording the insulin dose and the injection, or it's recording the glucose values. And with that recording, then that information can be discussed between the provider and the patient and can really help improve communication between the two. I also find that it's really valuable because you can then use that patient's data to discuss different concepts, and you can apply it to them themselves and how it would impact them, not just an abstract concept about diabetes management.
That's great. And even with all of these benefits, I have to imagine there's a lot of providers who are hesitant to talk about this or to recommend it. Are there common misconceptions you hear that might be preventing certain patients from getting this type of technology?
I think one of the misconceptions is, it used to be that this diabetes technology was only for certain types of diabetes. And that's really not the case anymore. People can benefit from using this technology regardless of the type of medication regimen that they're on. And for continuous glucose monitors specifically, I feel like it can be especially valuable, not just if they're on medications, but to look at the lifestyle side.
Okay. Yeah, this has been really insightful. So let's do a wrap-up question now. If you had just one piece of advice for healthcare professionals who are just getting started with diabetes technology, what would it be?
I would recommend checking out the Danatech website.
Oh, yay!
Reason being, it's a great resource for expanding your knowledge on all the different types of technology that's available to patients. I mean, it has the continuous glucose monitors, it has the different types of insulin pumps and technology, and can be a great place just to get some basic information about technology.
That's terrific. Thank you. And I did not pay you to say that.
No, you did not.
Well, thank you, Katrina, for being here with us. This has really been a great overview of the basics of diabetes technology. And that's a wrap for this episode of Danatech Talks, a special series from the Huddle from CDCES. I hope you found today's discussion valuable, and thank you again to Abbott for supporting this episode. Stay ahead of the curve with more expert-led conversations on diabetes technology. Explore additional topics at danatech.org for in-depth resources, training, and the latest in diabetes tech. And don't forget to subscribe to the Huddle so you never miss an episode. Thanks for tuning in, and we'll see you next time. The information in this podcast is for informational purposes only and may not be appropriate or applicable for individual circumstances. This podcast does not provide medical or professional advice and is not a substitute for consultation with a healthcare professional. Please consult your healthcare professional for any medical questions.